When I was diagnosed with breast cancer, it was stage 2. I was 34 years old, not really any family history of breast cancer, so it was very unexpected. So my cancer team at Mercyhealth was Dr. Mahatme, he's the breast surgeon. My oncologist is Dr. McFarland, and my radiation oncologist is Dr. Richards, and my plastic surgeon is Dr. Quinn. I had the most contact with Dr. Mahatme, who is wonderful. He's very caring, but he's also very straight to the point and gives you the facts of what you need to know. Dr. McFarland came up with a great plan for me. I remember when we first met him, when my husband and I first met him, he walked in the room and said, "Hi, I'm Dr. McFarland, but you can call me Tom." So I really felt very comfortable with my entire team. I felt very comfortable with Dr. McFarland right from the beginning. He just made me feel so comfortable and so confident that he knew how we were going to treat my cancer to help me live a long life. With the continuity of care at Mercyhealth Cancer Center, Dr. Mahatme kind of took the lead on everything, and I never felt like any of my doctors didn't know what was going on with me. Even from little things, if I had hurt my back and called my primary, Dr. Mahatme knew, Dr. McFarland knew. Everybody was always reading my chart and kind of keeping tabs on me. Which really helped because then I did not have to re-explain myself every single time that I was seeing multiple doctors. They always knew what was going on with me and always asked me how I was feeling, how I was doing recovering. The staff at the cancer center were absolutely wonderful. I could not have gotten through chemotherapy without my infusion nurses. They were wonderful. They never made me feel like I was just another patient. When I was there, I felt like I was their only patient of the day, even though there were multiple other patients there. They always treated me kind of, at one of their own as a family member, how they would treat a family member if they were going through cancer treatments. So that really helped me get through everything, was the chemotherapy nurses, even everyone from the nurses to the secretaries. Every time I called the cancer center, I'd say, "Hi," and say my name, and they would say, "Oh, hey, Melissa," so they really knew who I was, and we really got to know one another, which made it not so horrible going every time. So now I am cancer-free. I am just trying to get back into a new normal, kind of finding out who I am again. And it's nice that I'm always being followed up with by my doctors. The nurses are always following up with me just to check on how I'm doing. I don't feel like, since my treatment is done, that everything out, that my relationship is done. Everyone's still keeping track of me, checking in on me, making sure that I'm doing okay, and making sure I have everything I need.